Very good morning to respected judges and all my colleagues. I am Dr. Vaishali and I'll be presenting my paper on the topic Yoga and IOP, our experience. Thank you APO for providing me this opportunity, and first of all I would like to thank my guide Dr. Manisha Rathi ma'am and Sumit Sachdeva sir for guiding me and helping me out. Yoga. Yoga is a century-old practice with physical and mental health benefits, and it is gaining global acceptance worldwide. However, there is very limited evidence which exists on the specific effects of yoga on ocular physiology such as intraocular pressure. So we conducted this study to evaluate the acute effects of yoga on IOP in healthy individuals and to identify that which yogic poses are beneficial and which should be avoided in glaucoma patients. As was a cross-sectional prospective observational study which included 50 healthy individuals more than 18 years of age who were willing to be a part of my study, and we excluded those who were not willing to be a part of my study, less than 18 years of age, and pregnant females. We made 7 groups of 7 individuals each who were instructed to perform 7 yoga asanas for 2 minutes each, and then the IOP was measured using non-contact tonometer 2 minutes post-yogic session. These were the asanas which were included: Anulom Vilom, Vipreet Karani, Uttanasana, Adho Mukshvanasana, Tratak Kriya, Kapalbhati and Bhastrika Pranayama. We utilized SPSS version 29.0 for statistical significance and applied pair T test for intra-group comparisons and post-hoc-Tukey test for inter-group comparisons. A P value of less than 0.05 was considered for statistical significance. After all this cumbersome exercise, here are the results. In Adho Mukshvanasana, Tratak Kriya and Anulom Vilom, the IOP reduced significantly. However, it has increased significantly in Uttanasana, Kapalbhati and Bhastrika. Similar are the results of left eye. Coming to each yogasana individually, in Adho Mukshvanasana, the mean IOP before yoga was 16.29 with a standard deviation of 1.6, and the mean IOP after yoga was 15.86 with standard deviation of 2.12, giving us a p-value of 0.2, hence it was statistically insignificant. Similarly, the results of every yogasana were interpreted. So the mean age of participants was 35.98 with plus minus 11.45 years with range from 18 to 65 years with a gender ratio of 0.88:1. The key findings are that there is a significant decrease observed after Tratak Kriya and Anulom Vilom, and there is a temporary rise noted after Bhastrika, Kapalbhati and Uttanasana. So the positive impact was that in Tratak Kriya, Anulom Vilom, the IOP was reduced, and in Bhastrika, Kapalbhati, there is a transient increase in IOP. Hence, the non-inverted poses and controlled breathing technique should be incorporated in management of glaucoma patients, and the inverted poses should be avoided, particularly in glaucoma patients.